Good afternoon, everybody. Welcome to our media update. Today we are doing an update related to the release from the state this afternoon that the first case of the variant form of COVID-19 was an Eau Claire County resident. So we are here to share some basic information with the media and to answer some of the media questions. Thanks everybody for joining us. As I said, yesterday the state announced that there was a covariant case, and today it was identified that that individual was an Eau Claire County resident, is an Eau Claire County resident. We found out that information today, and we have been following up to make sure that we have information that we can share with you. I would encourage everybody on the media and others to look for the state Facebook page where Dr. Ryan Westergaard, our Chief Medical Officer for Communicable Disease, did walk through and describe the general information about this case of the variant strain of COVID-19 and what the state knows and what the state processes are. I'll walk through some of that basic information today, but we'll focus more today on answering some of the questions related to this being an Eau Claire County case. Again, I would encourage you to look at the resources that are available on that state website and the state Facebook page. What we do know is that an Eau Claire County resident did test positive for COVID-19. We have done a full investigation with that individual. That individual did travel internationally and was tested following return from that international travel. Symptoms began after that travel happened. There were only close household contacts. The only close contacts were household contacts, and all of those individuals were successfully quarantined. It's a good example of a positive case having a very, very small number, just household contacts, of close contacts. All of those individuals were quarantined. The disease investigation process that we do with every individual was done with this positive case of COVID-19 in Eau Claire. We found out today that the individual, because of routine screening that the state is doing on a certain proportion of samples that go forward and get tested, a certain percentage of those samples are looked at to see if that variant strain exists. It's called surveillance. It's what the state does and what is done to just get an idea of whether or not this type of strain, this variant strain, is circulating. In that process, this individual was identified as having that variant strain. We do know, and as we've talked about other weeks, we were expecting that this variant strain was circulating in Wisconsin, and we weren't necessarily aware of it. Now we do know that it is here in Wisconsin. We do know that it is in Eau Claire. We also know that the variant strain is existing in many, many states across the US, and you can go to the CDC website and find that information there. It is one of the reasons that we really encourage everybody to continue to double down on those efforts that make a difference in the spread of COVID-19, whether it's this variant strain or not. The same strategies work. Those strategies are keeping distance, making sure that you're wearing a cloth face covering, staying home if you are not feeling well, and getting tested. We also really strongly encourage you to keep your circles small. It will make a difference in the spread of this disease. The variant strain of COVID-19, I'll walk through a little bit. Again, I would emphasize that we do not expect from this specific case for there to be community spread. We did identify all the close contacts. They did all stay home. We also know that this variant strain is likely going to be circulating across our state. So we all need to pay attention to that. What we know right now about this variant strain is that it doesn't appear to make people more ill. It does appear to spread more readily, and that's why we have to pay attention to this. Spread happens in that same way. It happens with close contact and not wearing face masks, and we need to make sure that we are using those strategies that will make a difference. Again, a reminder that our state and our state lab work together to do this type of surveillance work. They look for these kind of variant strains. The specific strain that was found was B117. It's the strain that was found in England and that there has been a lot of press about. Researchers, again, are assuming that this strain is one that will circulate across the world and is one that we're watching for because it does appear to infect people at a higher rate. So it is seen as something that we need to pay attention to. We also, right now, do not have evidence that it causes more severe illness or more severe outcomes related to things like people dying from it. We also know that as we move forward, we may see other strains of COVID-19 coming forward. And again, part of the work in public health is to make sure we understand those, that we start looking at spread of disease, and we respond accordingly. In Eau Claire, my ask for everybody is to continue to do those things that we've been asking you to do. When they're sick, we need people to get tested. We need distance, that 6 feet maintained when you're with people other than your close household contacts, and we need you to wear a mask. Those things will make a difference. So with that, we will move to questions. We do have Dr. Ken Johnson here with us today as well from Prevea. He has made himself available if we have some specific medical questions. I certainly am available to talk through what we are learning from the State Lab of Hygiene and the state about what is happening with this specific case and what we've done as the local health department to do the disease investigation. So we will open it up to questions. Our usual process, like always, is that we will start with questions in chat, and I will have Audrey moderating that.
Lisa, the first question is from Todd Richmond of the Associated Press. Do you know when the person tested positive for COVID?
We do. The individual did test positive at the very end of December, and that they have completed their full time. They are no longer, they were not hospitalized, and they were home during their time of being infectious.
Lisa, another question from Allison Durr of the Milwaukee Journal Sentinel. Do you know if the person, or are you able to provide their gender, their age range, whether they were a resident and where they traveled?
What I'll share with you is that it is an Eau Claire County resident. It is someone in our community. That individual did travel internationally, and we are not sharing additional identifying information beyond that.
A question from Madeline Heim of the Post Crescent. Could you discuss how contact tracing efforts are going for this person and whether they've been intensified in any way from how you'd normally trace?
Thanks for that question. We did our normal disease investigation and contact tracing work that we do with all cases, and we did that a while ago because the case was identified really at the start of the new year. So that work had already happened. We did not know it was a case related to this COVID-19 variant strain until today. So all of the case investigation work had already been done. And we assured today that we looked at the potential of spread from this individual. And as I described earlier, this individual had no contacts beyond household contacts, and all of those household close contacts did remain quarantined.
This is a question for Dr. Johnson from WTOW. Since not everyone is tested for the strain, does that mean there could be many more unknown cases of it in Wisconsin? And should more be tested for the new strain?
So the good news is that this strain still tests positive for the general COVID test, so we can track the number of cases, including the new strain. In terms of whether more people should be tested for the new strain, it's good for us for planning purposes, but in terms of managing people and managing populations, we know this strain is circulating and that we have to step up our efforts to control the spread, whether that's one person, 10 people, or 100 people. So while I think it's good for figuring out where it is, our way out of this is to treat it as if it could be anywhere.
Dr. Johnson, another question for you from Sam Kramer at Fox 6 in Milwaukee. As Wisconsin works on its vaccine rollout, what evidence, if any, do we have of the vaccine's effectiveness on the new strain?
That's a great question. When we design vaccines, they usually target multiple sites on the viral proteins. When we look at where these mutations are, there's not enough of a match that we think this will be an issue, and we think it's highly unlikely that this strain will be resistant to the vaccine. That said, they're just now testing and finding out. But all the evidence we have points at the vaccine being very effective against this strain as well.
And I would just reiterate that vaccination is a really important effort moving forward. And at this point, the state is very clearly saying that there is not, as Dr. Johnson said, any evidence that there should be concerns with this variant and the vaccine that is available to people in that 1A group, particularly right now.
A question from Sarah Seifer with the Eau Claire Leader Telegram. Do you know around how many people with COVID in Eau Claire County have had whole genome sequencing done? And is the genome sequencing done locally or at the state level?
The genome sequencing is done at a state level. The state is making decisions about what % of the samples come in are sequenced. They also look at things like travel history based on the disease investigations that are done and make decisions about doing specific samples and doing this general surveillance. We do not know what their surveillance protocol is based on the total number. That would be a question for the state, but they are certainly working with CDC. All states are, to make sure that samples are looked at generally so that we get a picture of how this strain and other strains, those variant strains, may be spreading in our population.
We have a follow-up question in the chat box from Allison Durr from the Milwaukee Journal Sentinel, discussing or asking why officials won't provide information like gender or age range and where the individual traveled when other states have provided this kind of information.
Thanks for that question. We are working with the state right now to really walk and talk through what the appropriate information is that we will be sharing. So certainly when we are in a position to share additional information, we are happy to do that. At this point, we are sharing general information that it is an Eau Claire County resident and that they've traveled out of the country, and that we've worked with them to make sure that spread at this point from that case has not gone out into the community. We certainly will provide more information as we get to the point where we're able to do that.
We don't have any questions left in the chat box, so if there's someone that would like to ask a question live, please raise your hand and unmute. Are there any media on the call that would like to ask a live question of either Liska Giese or Dr. Ken Johnson?
All right. Thank you very much for everybody joining us. We are glad to get good information out to people about what is happening in Eau Claire County. Again, this is a news that is important to get out, but it's also important to remember that having this variant strain in Eau Claire County needs to be evaluated in the bigger context that this is the same COVID-19 virus with a variation, and we all need to be following those basic measures. Thank you.